Hello, my name is Nicola Jones, and today I'm going to be presenting some findings from the Gender and Adolescents Global Evidence Program on the impacts of the COVID-19 pandemic on adolescents. I'd like to begin by giving you a very brief overview of the Gender and Adolescents Global Evidence, or GAGE program. It focuses on young people in the second decade of life, between 10 and 19 years, and underpinning the work we do is a realization that adolescence is a period of great physical, cognitive, and social change for young people. And so it's a great opportunity for intervention to support young people in their transitions from childhood into early adulthood, but it also comes with a number of risks, particularly for girls as gender norms become more entrenched. It's also really critical to be focusing on this demographic because they make up approximately 1/7 of the world's population. So about 1 billion people, the majority whom reside in the global south. So the Gender and Adolescents Global Evidence Program is underpinned by a capabilities framework. So we draw on the work by Amartya Sen, looking at the different types of capabilities that young people need to be supported to acquire in order to be able to lead a life that they find meaningful. So we're interested in understanding the outcomes of different phenomena on their education and learning, their health and nutrition, their bodily integrity, so that is freedom from age and gender-based violence, their psychosocial well-being, their ability to exercise voice and agency within the family and within the community, and also the extent to which they're acquiring the skills and assets and resources to become economically empowered adults over time. So in order to explore these questions, GAGE has a mixed methods approach. We have a very large survey. It's the largest in the Global South working with adolescents. So it involves 20,000 young people in 6 low and middle income country contexts in East Africa, South Asia, and the Middle East. We then complement this with qualitative research with adolescents, their caregivers, community leaders, and government officials. And we also involve a smaller group of adolescents themselves in the research process, particularly to understand peer youth dynamics. So since the COVID-19 pandemic hit, we have leveraged this very large research sample to undertake virtual research by phone or web-based platforms to better understand adolescents' experiences of COVID-19. So we've undertaken 9,500 surveys by phone with adolescents in Ethiopia, Jordan, Palestine, and Bangladesh. So at the moment, the research we've undertaken has enabled us to understand the effects of the initial onset of the COVID-19 pandemic, and in subsequent rounds, we'll be able to explore slower onset implications and the medium-term changes in adolescent well-being. So for example, as the school closures are prolonged, what's happening to young people? Are girls, for example, now more at risk of child marriage? And then with already funded data rounds in subsequent years, we'll be able to, over time, contribute to the evidence base on the longer term impacts of the pandemic on adolescent capabilities. It's also important to note that the cases where the research is being carried out, not only is the evolution of the pandemic quite distinct, with some having limited cases initially, but then escalating waves over time, such as in Ethiopia and in Jordan, and also the national health response has been quite varied. So again, in Jordan, but also in Gaza, there was a very well-coordinated and quite strict lockdown initially, in contrast to the much more fragmented approaches that we saw in Bangladesh, Ethiopia, and Lebanon. So turning now to some of the headline findings that's been emerging from the virtual research that we've been undertaking. So firstly, our findings show that adolescents' knowledge about the virus and transmission mechanisms and prevention mechanisms is generally good, but there are some important challenges. So, for example, in Jordan, we found that 81% of adolescents in host communities report wearing a mask, whereas just 56% of those in refugee camps did. 74% of working adolescents had reported that their job had implemented some kind of safety measure, whether that's social distancing or hand washing, for example. And then in urban Ethiopia, the rates were high in terms of adolescents who reported maintaining social distance and in terms of reporting hand washing, although many complained that their compatriots were much less observant of the social distancing guidelines, particularly on public transportation. And in rural areas, the rates were also much lower because of resource constraints. In urban areas, we found that overcrowding makes hygiene measures and distancing difficult, that the protective equipment is not affordable for many, particularly when they're struggling to afford basic foodstuffs, and that water access is also another serious constraint. What we're also seeing, very worryingly, is that social protection systems are not being scaled or are not timely enough in terms of their interventions to offset the income losses that many households are facing. So our survey in urban Ethiopia, for example, found that 45% of the households in our sample had lost employment due to COVID-19. And in Jordan, amongst the working adolescents in our sample, 91% had reported having lost hours due to the pandemic. We also heard from a number of young people that their wages had been cut. So this was particularly the case with domestic workers and also those working at multinational industrial parks in Ethiopia. And for a number of them, they had either had to move home in order to find a place with lower rent, or some had become homeless and were now street connected when we were talking to them. Overall, the increasing economic toll of the pandemic has also translated into a sharp rise in food insecurity. So in Bangladesh, for example, 21% of adolescents reported going hungry in the last month due to the pandemic. And we also saw that girls were far more at risk than boys. So here's a very powerful quote from a young adolescent mother in Ethiopia. "What's the relevance of staying healthy if hunger is going to kill you any day? If Corona kills me, it would be a relief from this life. I just feel sorry for my son." As has been highlighted in the media, learning has also been severely disrupted because of the closures of schools and universities. So our survey in urban Ethiopia found that only 8% of students were able to access the education via TV or radio, and that only 7% of students were studying lessons provided by their school. And the figures were even lower based on our qualitative research findings in rural areas where there's real issues with connectivity. And then in Bangladesh, in Cox's Bazar, we found that host communities were having similar challenges. So only 6% of students were receiving learning support from their schools, and only 14% had been in contact with a teacher in the last week. Girls' access to education has been especially negatively impacted according to our findings. So in many contexts, their domestic responsibilities have burgeoned. Once they're at home, parents have much higher expectations of how much they will contribute to household labor, and they're not setting aside time for them to study. And in addition, this is compounded by the fact that girls tend to have less access to technology. This is driven by conservative gender norms where fathers and brothers in particular try to control girls' access to phones and the internet in order to protect the family honor. In terms of healthcare, our findings are also very concerning, showing that access to health services has been disrupted, particularly for sexual and reproductive health services. So, for example, in urban Ethiopia, our findings show that 20% of households reported disrupted access as a result of COVID-19. This was particularly pronounced for young people living with HIV and also for married adolescents and adolescent parents who were struggling to access affordable antenatal delivery and postnatal care. Our findings also emphasize that both age and gender-based violence is rising. So 2/3 of adolescents in our urban Ethiopia sample reported increased intra-household stress and tensions because of the phone interviews. We suspect there's quite a lot of underreporting, and that our qualitative research highlighted that many were experiencing heightened verbal violence, physical violence, and domestic workers, for example, found that they were under increasing risk of sexual violence also. And in Bangladesh, similarly, more than 1/5 of the married Rohingya girls in our sample reported that gender-based violence had become more common, particularly intimate partner violence with their husbands. In terms of child marriage, so far the short-term effects seem to be mixed. So we're finding in some contexts that young people are more vulnerable to child marriage, particularly in Ethiopia when they're out of school. Boys that we found there were also at heightened risk, whereas in other contexts, because the economic downturn has meant that families have fewer economic resources, they're actually reporting that there could be less of an impact. And then finally, we've also looked at the effects on adolescents' psychosocial well-being and mental health, and we're finding elevated levels of anxiety. In Jordan, for example, 59% reported that they were afraid of COVID-19, 20% reported that they were getting decreased emotional support from the family, and 32% also highlighted that they were needing to provide more support themselves to their family. Our findings also highlight that particularly for girls and young people living with disabilities, that social isolation during the lockdowns can be extreme, and they have very limited access to peer networks and to trusted adults beyond the family at this time. So what are the policy and practice implications of our findings? I think one of the key things that comes up very clearly is the need to scale up emergency social protection that can address economic vulnerability, provide better food security, and also ensure more equitable distribution of hygiene supplies. It also seems critical that once schools do return, that there's outreach to the most vulnerable. Girls and adolescents with disabilities are particularly concerned that they may not, without support, be able to re-enroll. And there's also clearly a need to strengthen accessible distance learning options, again with a particular focus on ensuring accessibility for young people with disabilities and for girls. It's also urgent to invest in resuming health and sexual and reproductive health services for young people, especially for pregnant girls, adolescent mothers, and young people living with HIV, but also to address the very high mental health toll of the pandemic, given the elevated levels of anxiety and fear that our findings highlight. Similarly, the need for expanding gender-based violence and child protection reporting mechanisms with the closure of schools, where these institutions have been key mechanisms to protect young people, then alternative mechanisms need to be developed and scaled up. And similarly, there's a need to ensure that there's dedicated support and reporting channels for young people at risk of child marriage. So you can read more about our findings on a range of our publications, which you'll see on the GAGE website. So we have briefs across all of our countries, drawing on both the quantitative and qualitative data, but we've also shared the research tools, both the survey and the qualitative research tools, for those organizations who are keen to explore in their context some of the pandemic effects. Thank you very much.